Feeling down every once in a while is a normal part of life. But if these feelings last a few weeks or months, you may have depression. Today, we will share some of the common signs and symptoms of depression, treatment options, and if you or your loved one may be at risk for depression. Depression is a severe mood disorder. It can affect the way you feel, act, and think. Depression is a common problem among older adults, but clinical depression is not a normal part of aging. Studies show that most older adults feel satisfied with their lives, despite having more illnesses or physical problems than younger people. However, if you've experienced depression as a younger person, you may be more likely to have depression as an older adult. Depression is serious, and treatments are available to help. For most people, depression gets better with treatment. Counseling, medicine, or other forms of treatment can help. You do not need to suffer. Help and treatment options are available. Talk with your doctor if you think you might have depression. There are several types of depression that older adults may experience. Major Depressive Disorder includes symptoms lasting at least 2 weeks that interfere with a person's ability to performing daily tasks. Persistent Depressive Disorder, Dysthymia. A depressed mood lasts more than 2 years, but the person may still be able to perform daily tasks, unlike someone with Major Depressive Disorder. Substance or medication-induced depressive disorder. Depression is related to substances like alcohol or pain medication. Depressive disorder due to a medical condition. Depression is related to a separate illness like heart disease or multiple sclerosis. Psychotic depression. Psychotic depression occurs when a person has severe depression plus some form of psychosis, such as having disturbing false fixed beliefs or hearing or seeing upsetting things that others cannot hear or see. The psychotic symptoms typically have a depressive heme, such as delusions of guilt, poverty, or illness. Seasonal affective disorder. The seasonal affective disorder is characterized by the onset of depression during the winter months when there is less natural sunlight. This depression generally lives during spring and summer. Winter depression, typically accompanied by social withdrawal, increased sleep, and weight gain, predictably returns in seasonal affective disorder every year. Depression may be a risk factor. Many things may be put you at risk. For some people, changes in the brain can affect mood and result in depression. Others may experience depression after a significant life event, like a medical diagnosis or a loved one's death. Sometimes, those under a lot of stress, especially people who care for loved ones with a severe illness or disability, can feel depressed. Others may become depressed for no apparent reason. Research has shown that many factors are related to the risk of depression, like medical conditions such as stroke or cancer. Genes, people who have a family history of depression may be at higher risk. Stress, including caregiver stress, sleep problems, social isolation and loneliness, lack of exercise or physical activity, functional limitations that make engaging in activities of daily living difficult, addiction or alcoholism. The COVID-19 pandemic has brought new attention to this issue. However, many Americans felt socially isolated and lonely before the pandemic. Depression is seen differently with age. So guys, now the question is, how do you know if you or your loved one may have depression? Depression in older adults may be difficult to recognize because older people may have different symptoms than younger people. For some older adults with depression, sadness is not their main symptom. Instead, they could feel more numb or a lack of interest in activities. They may not be as willing to talk about their feelings. There are some common symptoms like persistent sad, anxious, or empty mood, feelings of hopelessness, guilt, worthlessness, or helplessness, irritability, restlessness, or having trouble sitting still, loss of interest in one's pleasurable activities, including sex, a decreased energy or fatigue, moving or talking more slowly, difficulty concentrating, remembering, or making decisions, difficulty sleeping, waking up too early in the morning, or oversleeping, eating more or less than usual, usually with unplanned weight gain or loss, thoughts of death or suicide attempts. If you have several of these signs and symptoms lasting for more than 2 weeks, talk with your doctor. These could be signs of depression or another health condition. Don't ignore the warning signs. If left untreated, severe depression may lead to death by suicide. Then we should stay away from depression. But how? Don't worry, we have some tips that will help you to avoid depression. Number 1. Avoid stress. A 2012 study trusted source conducted with veterinary students found that stress had an adverse impact on mental health, life satisfaction, and general health. People who have a susceptibility to depression may have a higher risk of developing it if they have chronic stress. It is not always possible to avoid stress, but taking steps to do so may help. These include getting enough sleep and rest, learning to say no to additional demands, taking breaks from work, practicing breathing exercises and meditation. Get regular exercise. Number 2. Exercise. Research trusted source shows that physical activity can act as an antidepressant, and experts encourage doctors to include it as a treatment. A 2018 reviewed trusted source describes exercise as an underutilized treatment for depression. The authors note that it can boost both physical and mental well-being. Current guidelines recommend aiming for 150 minutes trusted source of moderate intensity exercise each week, broken into sessions that could be 5 minutes, 10 minutes, 30 minutes, and so on. Number 3. Diet. A healthful diet may help prevent depression and boost mental well-being. A 2019 study trusted source concluded that dietary interventions could play a role in treating depression. Number 4. Sleep. According to an older article trusted source, there is a strong link between depression and insomnia. A lack of sleep may worsen symptoms of depression, and it is also a common symptom. Do breathing or relaxation exercises before sleeping. The 4, 7, and 8 breathing technique can also calm anxiety. Speak to their doctor before using any supplements or medications to ensure they are safe to use. Number 5. Talking therapy. Psychotherapy trusted source, or talking therapy, can help people identify the causes of depression and find practical solutions. There are some options include counseling for specific issues, such as bereavement, cognitive behavioral therapy, CBT, which can help a person find new ways of thinking and acting, psychoanalysis, which often looks into past issues. Therapy can be one-on-one, with a group of people who meet just for therapy, or with partners or family members. It is not always possible to prevent or avoid depression, but effective treatment is available, and some lifestyle choices can help manage symptoms and prevent a recurrence. If symptoms of depression are overwhelming, or if a person is thinking about self-harm, death, or suicide, they should seek immediate medical attention. So guys, that's all for today. Stay healthy and stay with health conscious.